Hello, my name is Kylie and I'm a technician here at the Cat Care Clinic, and we're going to go over the stress-free way of getting blood collections. We recommend getting blood collections so that we can just make sure that your kitties are staying healthy and making sure that we keep an eye on like how their blood values are doing. And we're going to show you one of the ways that we mainly collect, and things to make sure that we do is making sure that everybody's remaining calm and we're remaining quiet, and also making sure that we're applying reassurance to the cat, making sure everything's going to be okay. And we're always going to make sure that we have like a nice comfortable blanket available, and so that gives them reassurance that everything's going to be okay. So you'll see that when we're going to be going through this, we're going to be constantly petting them, reassuring them, talking quietly, and while we're doing the blood collection. So just gently putting him on his side, and so we'll just be giving him a gentle hug, and so that he can still sit up, and we'll take everything into consideration. So like if this technique doesn't work well for your kitty, there's other techniques that is definitely available, and so that your cat remains the most stress-free as possible while they're getting their blood collected. Things that we like to make sure we always recommend is making sure you have everything available so that it makes it the quickest, fastest collection for your kitty. So things that I like to always use is a typical anesthetic. So I'll put that a little bit on my hand right there. So I'm going to right now is just going to do a little cleansing, just get the hair all wet. And I'm just gently holding the foot, and I'm just going to part the hair so that I could see where the vein is. I'm going to apply this anesthetic. So this anesthetic is really nice so that the cat doesn't feel the actual poke. And we'll let that sit on there for a little bit, just so that it takes effect, so that it doesn't feel the venipuncture. And as you can see, he's pretty comfortable, and we're just gently holding the foot. After letting that anesthetic apply for a little while, it'll take effect so that he doesn't feel the poke. We always use the smallest needle available to make sure that it's the least painful. So when I'm going to poke, I let my partner know that I'm going to go do a venipuncture, and making sure everybody's ready and everybody's feeling comfortable. I'm going to go poke. And it's just a quick poke underneath the skin, and then I'm just going to collect his blood. And as you can see, it's slowly collecting into the syringe. And see, still remaining close body contact, applying reassurance, seeing mine is very minimal restraint, and making the kitty stay calm. Doing such a good job. And once I get enough of what I need for the labs that are going to be collected, I let my partner know that I'm going to pull out shortly, and I'm always going to cover it with a gauze. And see how she's changing her hands so that she can hold off appropriate for the venipuncture. Now I'm just going to be making sure that my blood's getting the proper tubes, so that for the labs that we submitted. She's going to remain holding off that spot where I pulled out. So now I'm going to check to make sure everything is okay. And see he's not bleeding. I'm going to wipe off that little anesthetic because we wouldn't want them to lick that area and possibly get like a little anesthetic on their tongue. Everything's cleaned up and everything's gone, and he's all good to go. And that is how you do a blood collection at Cat Care Clinic with the least amount of stress for your cat. Thank you, Cody. So as you saw, Cody did really great for his venipuncture, or his blood collection. That's what's important about what's at Cat Care, is that we assess the cat during their exam to whether or not what would be the best for them during their assessment. So things that we have alternative is that we have what's called a calming cone, and which that would be applied over the face, and allowing them to, sometimes it'll help calm them while we can still get our collection with also still minimum restraint. Some kitties will still need a gentle wrap with a towel, which is just a gentle wrapping with them to make them get reassurance that they're okay, and that's also making sure everybody still stays safe. In some regards, if kitties are too stressed, sometimes a doctor might recommend an anxiety medication that will be given prior to coming for their venipuncture. This will allow them to come in on the medication that reduces their anxiety, so that it helps make sure that day at the clinic is stress-free. And it minimizes any type of anxiety that may have coming to the clinic. Because we want their visits to the cat care clinic to be as minimal stress-free as possible, as you can see. And we want them to be able to enjoy their visit when they come here for their appointments. And as in regards to using the anesthetic, we don't use the anesthetic for every patient. We will generally assess the patient depending on what their recommendations are. And the lidocaine will have to sit on the skin for typically 10 to 20 minutes at least, prior to getting the venipuncture. So just applies the best anesthetic properly so that they don't feel the puncture.